for Dr. Mohammed Salman.
Let me check. I think we can start and he can join later on. Yeah.
Okay. So, good afternoon to everyone, and thank you for joining us. My name is Dr. Rehan Zafar Bracha, and it is my privilege to welcome you all on this webinar. Today's session is about Pakistan wastewater environmental surveillance strategy, from strategy to sustainable action, financing the future of wastewater environmental surveillance. So the basic objectives of this session are to introduce the present Pakistan's approach towards WES, discuss the economic rationale for investing in WES, explore financing models, and identify the priorities for integrating WES into national surveillance systems. Today, we are honored with the presence of our worthy panelists and speakers to discuss these objectives. I am thankful to Dr. Mohammed Salman, Chief Executive Officer, National Institute of Health, Pakistan, Ms. Megan Diamond, Senior Technical Advisor to WHO Hub for Pandemic and Epidemic Intelligence. Thank you very much, madam. Dr. Pang Vincent, Assistant Professor at Duke Nurse Medical School, Singapore. Thank you very much, Dr. And Dr. Afrinish Ahmed, Medical Microbiologist, National Institute of Health, Pakistan, for joining this session. Before we begin, I want to request the participants that please use the chat box to submit your questions at any time. We will address as many as possible during the panel discussion. This session is being recorded and e-certificates will be shared with all the registered participants at the end. To open the session, I am delighted to invite Dr. Afrinish Ahmed, medical microbiologist at NIH, Pakistan, to walk us through Pakistan's on-ground experience with wastewater environmental surveillance. Dr. Afrinish, over to you.
Thank you, Dr. Rehan, and thank you, Vincent and Megan, as well, for joining us for this webinar. So the idea of launching this webinar is just to have a good discussion towards the next steps, that we have launched a strategy and now where are we heading towards. Just to make the background, I'm definitely going to share some of the slides with all of you, just to make you understand that how the process has developed and where are we heading towards right now. Let me share the screen. My slides first. Okay, so can you see the slides and screen?
It is visible.
So to begin with, just to give you a background on the National Wastewater Environmental Surveillance System that we are doing at National Institutes of Health in Islamabad right now. Just to begin with, Pakistan has already been doing a number of activities on wastewater surveillance and activities for quite a long time. And we have seen that there are a number of other institutes which are contributing to the wastewater system, which we have contacted during development of this thing. And NIH plays a pioneer role in the wastewater system through the launch of its polio laboratory surveillance across the country since last 3 decades now. And we have also leveraged on the polio network for developing the other wastewater surveillance-based system like cholera, typhoid, and in the very recent COVID-19 as well. So in the last 3 years, there was a high need and high discussion that we have to develop something more foundational for wastewater surveillance within the country. In the last 3 years, NIH, along with the collaboration of Asia Pathogen Genomic Initiative and Gates Foundation, we have tried to establish a national wastewater surveillance system. And the idea behind this thing is that we have to bring all the stakeholders on one page. We have to do the advocacy and awareness towards the West within the country. And we have to do the sample then the next step is that once the mapping has been done, we need to go towards the wastewater sampling site identification, development of the protocols, development of the sample collection, and NGS laboratory and bioinformatic protocols. Capacity building of the workforce, both at the field, also in the laboratory, it is also ongoing right now. And then the final and the main step is that how are we moving towards the costing for the West within the Pakistan for more sustainability. just to walk you through about the different consultative meetings that were being conducted to develop this national wastewater surveillance strategy. We conducted our first workshop back in April 2025. All the key stakeholders, which I'm going to show you in the next slide, they were being invited. They were being discussed that what were their contributions to the wastewater system over the time, and there was a very thorough discussion towards the how the strategy should look like and what should be the key vision and objectives and other parameters that needs to be considered. Again, this was connected with the pathogen prioritization workshop. We need to identify a set of pathogens on which the country can conduct a best surveillance over the time. The second workshop was more focused on towards the laboratory practices and protocols. And we have done the third workshop, which focused on the pathogen genomic surveillance cost analysis. So that remains a very key element in any kind of project or activity that we are doing, what should be the cost on any particular activity, and how can we generate the funds, and how can we make the system very cost effective. Some of the key activities I'm just presenting over here. We have identified a sampling site through using different methods like GIS-based method mapping, and then this was followed by local site visits for site validations. There are a large number of sites that were identified in the first instance, and then looking at the catchment area and the other parameters, 14 different sites were identified right now. We have developed the laboratory protocols for sample collection, processing, and metagenomics. Sites were being trained, sample collectors were being trained on this process. Laboratory personnel, they were being trained on 16S metagenomics and TACMan arrays. Laboratory SOPs and protocols were being developed. Again, coming towards some of the other activities, we again have the focus to understand the bioinformatic analysis of the data that we are going to generate from the wastewater surveillance. So we have developed an end-to-end bioinformatics pipelines for data analysis. There are a number of advocacy sessions that were being conducted on various different topics, ranging from the laboratory to the legal and ethical aspects of the wastewater surveillance, towards the environmental surveillance as a tool for pandemic preparedness. Then we did a number of sessions on the assessing the feasibility and costing and system level implementation of the waste systems. Some of the key outcomes that I'm presenting over here, one of the outcomes is the development of a national strategy, which is endorsed by the Ministry of Health itself. And then a list of the priority pathogens were identified. And the most important is a national wastewater genomic surveillance costing tool has been developed. So that is one of the key things that was developed through a consultative process. We were following the WHO costing tool guidelines and tried to develop a simple costing tool that if any institute or organization wants to do the costing for the waste, they can always rely on this tool and identify the cost that can be engaged in it. The launch of the National Wastewater Environmental Surveillance Dashboard. It happened last month in July, and it is hosted at National Health Data Center at National Institutes of Health. And whatever data we are generating from the West, it is being plotted on the dashboard, and it is being shared with many of the stakeholders just to have their understanding that they have to use the data that whatever we are generating from the laboratories. Now, coming towards the Pakistan West strategy itself, some of the key elements that we wanted to discuss over here, and that will make a good basis for the next panel discussion. It is a very consultative process. We have engaged almost all the key stakeholders which are working on the wastewater within the country right now, ranging from the Ministry of National Health Services, Regulations and Coordinations, Ministry of Climate Change and Environmental Coordination, Ministry of Water Resources, Ministry of National Food Security and Research, Federal Directorate of Immunization, district health offices, provincial health departments, mainly the water and sanitation agencies, working with the sewage networks within the country, public health engineering departments, municipal authorities, waste management organizations, Aga Khan University, Duke National University, Singapore, and Asia PGI, all the development partners. So it was a very, very thorough consultative process. During our workshops, they keep on coming, they keep on sharing their feedback with us through the emails as well. And then we have done some consultative workshops online as well. And this has led to the development of a national Pakistan West strategy. The vision is to establish a sustainable, nationally coordinated, multi-pathogen wastewater environmental surveillance system that can enable early detection of the public health threats and supports timely and evidence-based public health action. So the idea remain towards the public health safety and public health action by using the data from the wastewater systems. The key objectives for the West strategy that has been identified through this workshops to consolidate and strengthen the existing West capacities, including the lab system, field operations, and stakeholder networks, to prioritize the target pathogens for surveillance based on the public health significance, epidemiological trends, technical feasibility, and ensuring with the national health priorities, to develop and standardize the operational protocols for wastewater sampling, laboratory testing, data analysis, and quality assurance, and to establish a clear governance framework and sustainable financing mechanism to support the long-term implementation and scalability. And finally, to integrate this data, we have to make use of this data for the public health benefit, for the public health decision making systems, to ensure the timely outbreak detection, risk assessment, and evidence based policy formulation. So one of the interesting element that was happened during the workshop is the SWOT analysis on the West. So we were trying to identify the existing strengths, weaknesses, and what opportunities that we can see, and what could be the threats for the wastewater systems within the country right now. So what we have seen during our discussions that there is an established infrastructure in form of the polio environmental surveillance network with the trained laboratories, trained staffs, and SOPs available with them. Secondly, we have seen some of the policy and governance frameworks. There is existence of the PEPA 1997 Act and then National Action Plan on AMR. We have seen frameworks on One Health that shows the strong governmental and international partnerships. Technical expertise that has been developed over the years, considering the different areas like AMR, genomics, and we can also always leverage on the existing expertise. Data tools in the form of National Health Data Center, IDSR, genomics dashboards, AMR networks, influenza networks. These data tools, they are always very supportive in finalizing the next steps for the West. What could be the what could be the possible weaknesses that we have identified? The infrastructure of the sewage networks and the sewage systems that remained a challenge, especially in the remote areas. And then there's no centralized metagenomics laboratory for the comprehensive wastewater testing. Then comes the funding element that remains that always cause a limit towards the ongoing wastewater testing. Coordination and data sharing that was siloed between the different organizations and the sectors, and that there's a lack of a unified data platform and the poor stakeholder communication. So that made us to do the stakeholder mapping and also do the dashboard development just to overcome this biggest challenge that we were seeing. Operational challenges, lack of awareness and advocacy, and some particularly West needs some of the advanced metagenomics techniques and the TACMAN's arrays. For that, we are seeing lacking in the in the staff and the technologies. Some of the opportunities that we can rely within the country, we can see that we can utilize the GIS mapping for site selection and data visualization. We can always adapt the AI-driven pathogen detection and portable sequencers, integrate the West with the wastewater treatment plants. We can see that the stakeholder collaborations can be a biggest asset, form a centralized consortium to standardize the protocols, leverage on the existing field site capabilities, and community leaders for the outreach. Public engagement, launch the behavior change campaigns via social media to build trust and awareness, and sustainability through the coordination with the government commitment towards the best systems. The possible threats can be operational risk because of the climate change issues. There can be data or security reasons that can be a threat to the ongoing data generation, and then the system vulnerabilities can also be there. So that was really eye opener for us as well and all the participants. And we have done a number of exercises to formalize number of the elements that we have identified during this exercise. Now, briefly coming to the criteria for the pathogen prioritization. So, it was another big exercise. There are a number of key factors that were being considered while we were considering the pathogen prioritization. Public health impact. We have considered the prevalence and the seasonality of the disease. What is the environmental persistence? Then we looked into the transmission routes, priority for the pathogen with waterborne, foodborne, or zoonotic transmissions. AMR remained one of the key areas. Then we have done talked about the emerging threats that can be identified by leveraging on the West systems, regulatory alignments, analytical feasibility, socioeconomic factors, One Health relevance, vaccine preventable diseases, a very important element, and drug treatable pathogens. So there were a number of criteria that were being discussed with the pathogens, and we have a long list of the pathogens that were being discussed with the participants against all these criteria. So it's a long workshop. We discuss each and every element, and people keep on giving their feedback, which has led to the prioritization of these West pathogens, 33 pathogens for the wastewater surveillance right now. So from the bacteria, the high priority considered are the Salmonella typhi, Vibrio cholerae, Klebsiella pneumoniae. From the medium priority, Shigella, E. coli, Staph, Campylobacter, Pseudomonas. From the viruses, influenza, poliovirus, norovirus, rota, adenovirus, and hepatitis A and E virus, and the ongoing mpox or the dengue viruses. From the fungi, Candida auris was again highlighted as one of the key pathogens that can be detected from the wastewater, and then Plasmodium falciparum and Vivax from the parasites. So this was the list that was being targeted right now from the laboratory perspective as well. We are doing the 16S metagenomics followed by the TACMan arrays, which is targeting all these 33 pathogens, and there are 96 different targets which are being targeted right now. Sorry, this is a little blur slide, but again, the wastewater-based surveillance, the site selection framework, it was a very comprehensive process that was being followed. We have defined the objectives. What should be the idea for the site selection? Then map the population and the catchment areas being identified, and we have done GIS-based mapping and identification of the hotspot areas, and we have tried to correlate this data with the ongoing IDSR clinical data that is being received. Followed by that, our team have visited different sites themselves to identify the catchment area, correlated the data with the local provincial bodies, with the local EPA and local VASAs to identify the sewage networks, that how can it impact overall surveillance that we are going to do. So the last slides, in the strategy, you will definitely see the details on these key elements. While developing the document, some of the programmatic considerations were being considered very closely. One is the integration. Whatever we are generating the data, the technical capabilities or the laboratory systems or the trained staff, that needs to be integrated with other systems as well, including EPA, the DRAP, the Federal Directorate of Immunization, VASAs, PCRWR, Ministry of Climate Change, Ministry of Food Security. Everybody needs to be integrated from one concept, and the data should be utilized for the public safety. Sustainability remains one of the key elements that is always being discussed. Some of the practical elements, sampling frequency, logistics, laboratory processing techniques, and how these can be made very cost effective, they were all discussed. Costing for West and legal, ethical, and policy framework. This is the thing which is ongoing right now, and we look forward to establish more solid frameworks towards the costing and also for the legal, ethical frameworks within the country for West. The last slide, the strategic recommendation for the West is to have a very policy framework. We should have a governance framework as well. Advocacy, capacity building, and communication, always the key element to propagate the message to all the stakeholders and also to the community. Infrastructure development, I mentioned earlier as well about the data integration and utilization, sustainability and capacity building, and then finally monitoring and evaluation and lessons that we are learning from the ongoing systems, and how can we improve and go for the continual improvement. So some of the key activities, they were being done. Last month, the strategy was launched formally by Honorable Federal Minister for Health, and we look forward towards the implementation right now from the various different angles. So I just stop over here and thank everybody for this important initiative within the country right now, and we look forward to its support. Over to you, Dr. Thank you.
Thank you very much, Dr. Afrinish. That gives us a strong foundation. We have heard how WES is built in Pakistan, the value it has already delivered, and the strategic thinking behind it. Now, let's turn to the harder question, I think, facing every country. How do we finance this for the next decade? For this, we are going to start the panel discussion, and my first question is from Ms. Megan Diamond about making the investment case. Governments often view WS as an additional surveillance cost rather than a long-term investment. Megan, from your work at WHO Hub for Pandemic and Epidemic Intelligence, what evidence or messages have you found most effective in convincing policymakers that WS delivers measurable health, economic, and social returns?
Thanks so much for this question and for inviting me to be in this panel discussion, and congratulations on the launch of this national wastewater surveillance strategy. It is a huge accomplishment and sets an example for many countries to come. So it's a great question, and how do we think about messaging to policymakers that WES is really important and something that should be invested in? I think one thing I want to start off with is hitting on the costing element, which you emphasize that this is a priority, that you're developing a costing tool. When we have conversations about wastewater environmental surveillance with policymakers, oftentimes you'll hear it's cost effective, it's less expensive than clinical surveillance. And there's two things I want to pick up on that. The first is which is, let us not make it in opposition to clinical surveillance, but rather as a complement to clinical surveillance. And so in all of our messaging and framing, it's not this or that. When we think about public health surveillance, it's many different data streams coming together to create a really comprehensive picture of what's happening on the ground. We don't look at just one public health data stream and make decisions off of that, right? We think about it as all together. So one thing that we found really effective is to frame wastewater surveillance as part of public health intelligence. It's part of public health surveillance. It's not a this or that conversation. And when we come to the costing element, oftentimes you hear this, it's low cost. But what we really need to do is articulate what that means and actually bring data on what we mean when we say low cost, because that's a relative term and doesn't mean the same thing to different people. So one thing that we're doing at the WHO Hub is we are building a wastewater environmental surveillance laboratory costing tool. And this is a complement to the existing pathogen and genomics costing tool that was referenced, that it sounds like amazing that it is being used in Pakistan as a launching point for a national tool. And so we're building a global tool. And the tool is intended to support countries, specifically laboratories, that are estimating the financial and operational requirements of pathogen-focused wastewater and environmental surveillance across program design to sample collection, all the way to data analysis and quality assurance. And this tool makes it so that you can understand your operational costs. This could be used to apply for grants. This can also be used as justification. When you have hard evidence, when you have a really solid tool that was either developed by the WHO or developed by a national government like that in Pakistan, that's when you really are able to move the needle on a concrete conversation about investing in funding decisions. What is the ask, and where can we pull that money from or integrate it to? And if it is truly cost effective, as we say it is, we can demonstrate that it is something that is doable. It's money that we already have and doesn't pull away so much from another program. And so I'll stop there because we have such a rich panel and many questions, but just really emphasizing framing this as public health intelligence, framing it as one piece of a much bigger puzzle that adds a very unique contribution. And when we say low cost, making sure we're using the available tools and resources to actually put a number behind what we mean by low cost.
Thank you very much, Megan. And really, you have brought a very important piece of puzzle that it is a one piece of a bigger puzzle. It's not the segregated system, or it should be complementing the clinical data. Now, I have some questions regarding the from pilots to sustainable programs from Dr. Vincent. Many countries have successfully implemented donor-supported WES pilots, but sustaining these initiatives remains a challenge, Doctor. Drawing on your work and experience across the region, what practical strategies can countries adopt to transition from short-term projects to nationally owned and sustainably financed WES programs? Dr. Vincent, is Dr. Vincent with us?
Thank you very much, Dr. Rehan, and thank you very much, Dr. Afinish, and congratulations again for the very impressive effort and work that has been done so far in collaborations with Asia Pathogen Treatment Initiative in the Center for Public Preparedness at UNUS Medical School. It is our real privilege to be having you, as well as the National Institute of Health, under the leadership of the CEO, Dr. Saman, who are very supportive in championing for the WES strategy in collaborations with the Aga Khan University in Pakistan and for Pakistan in the future. And with regards to the questions from pilots to sustainable programs, as we are working very closely with a number of countries in Asia, in particularly some of the low and middle income or resource constrained countries. Indeed, it is always challenging, to try to translate or transit from pilot projects or including research projects into a nationally potentially co-financed program for sustaining some of the good work that has been already successfully built up with the catalytic funding, especially from external donors or philanthropies. And I would say that it is critical for the national champions, in each country who are deeply invested and has very strong evidence to highlight the need and the value for wastewater surveillance to enhance their overall collaborative surveillance for the country, to try to reduce the public health burden, to continue to engage and communicate as closely and as frequently as possible to all the relevant stakeholders that you have already engaged with during the process of this consultative process to develop this national WES strategy. It is so important to continue this communication with the relevant stakeholders because of the fact that we know that there's a great opportunity for us to leverage on the needs of the different stakeholders and also their voices in terms of trying to understand how the data from the current wastewater environmental surveillance strategy can help them to fulfill some of the additional or even complement some of the additional data that they actually need to answer some of their public health questions. I can give you an example, for example, in the sense of the Ministry of Agriculture. So as much as we are, advocating for the need for enhancing human protection and human health, as we always believe that, it is so important for us to also look at One Health approach, of course, one step at a time. So moving beyond looking at just, human health, there's also an opportunity for us to work with animal health authorities, such as the Ministry of Agriculture, to try to understand, the needs of theirs, and then try to discuss and consult together on the value of WES to try to understand whether there's a chance for them to make use of WES to understand and also pick up earlier signals for animal health diseases that potentially could be zoonotic as well, that may also affect your human populations. So with this integrative or consultative continuous process, there's a high chance that we can actually try to empower some of the other stakeholders, to combine the voices to engage larger senior stakeholders in the leadership or in the leadership of the government to look at how can we actually try to increase the budget for not just human health surveillance, but overall national integrative collaborative surveillance strategy as part of the overall pandemic preparedness plan. So I think with this continuous communication and closer empowerment of the other stakeholders to be involved in this discussion will be highly critical as baby steps. And I must say that it will take time. So we have to be very patient and we have to be very active in consulting some of these stakeholders to be part of this championing for the national own and finance WES strategy. So maybe I'll just stop here and happy to hear any other comments and guidance. Thank you.
Thank you very much, Dr. Vincent. You are very right that we need to have an integrative and consultative process with other stakeholders to combine the viruses for One Health rather than only going for the human health, because it's a complete system, and then we can get some of the important variables which can brought the pilots to sustainable programs. So over to you, Dr. Afrinish. How we can demonstrate the value, like beyond outbreak detection, where have you seen WES generate the greatest value? From Pakistan's own experience, can you share some of the examples of how WES has informed public health action, protected communities, or improved decision making on the ground?
Thank you, Dr. Rehan. So WES remained one of the key elements for Pakistan. We are facing the challenge of the polio, and this is the biggest example that is helping us a lot to understand the polio surveillance, presence of the polio virus in different communities, and eventually correlating this vulnerable communities for the vaccinations and for the other control measures. Other good examples that I can share is during the time of COVID-19, we leveraged on the WES systems, and we were able to identify the hotspots and likewise that was connected for the public health action, that where the lockdown should be done, where the communities can be protected, and the decision making totally relied on this approach by seeing the presence of the virus within the wastewaters. Through my own engagement in the cholera and the typhoid, we totally leveraged on this system to identify the cholera outbreaks that were happening in different parts of the country, particularly after the monsoon, after the rainy seasons. And then for the presence of the extensively drug-resistant typhoid, this is one of the biggest examples that we have we have few of the initial cases of the XDR typhoid in the country, and they were being reported from one province. And again, we leveraged on the wastewater systems to identify the transmission dynamics which happened between the different species, so that the Salmonella typhi eventually acquired the resistance genes against different antibiotics. So it's like WES is more than an outbreak detection tool. I must say it is a very early warning and a decision support system. And in a country like ours, this can be a very valuable approach to guide us for the targeted actions. We can identify the geographic areas where additional clinical surveillance, laboratory testing, IPC measures, even vaccinations or risk communication could be strengthened. Again, I mentioned about their role in the AMR. Tracking the antimicrobial resistance genes and resistant organism in the wastewater, they can always provide a very good picture of the community level AMR circulation and can complement ongoing the clinical AMR surveillance from the tertiary care hospitals. We can always look from this aspect, from the One Health aspect. A few years back with WHO, Dr. Farah Sabi is online as well. We have done one project based on the tricycle, ESPL E. coli, from the One Health perspective, engaging the human, animal, and the environmental sectors just to identify the presence and the transmission dynamics of the ESPL E. coli. So One Health remains one of the key elements for the WES as well. For a country like ours, we have resources constrained. So WES can help answer where to look and when to act, and where to prioritize our limited laboratory and the public health resources. So that can always help us to go on a very targeted approach. So for me, the greatest value of the WES is not simply detecting an outbreak, but it is giving a very public health, population level lens that can help us to identify what is happening in the communities, where risks are emerging, and can always support the decision making through along with the routine clinical surveillance. So I just stop over here.
Thank you very much, Dr. Afinish. You are very right that a very successful program of polio surveillance is there, established in Pakistan, and it is doing great work. And if we are going to add 90 or more diseases and the bacteria viruses for the identification and correlating with the immunization schemes which is being running by different ministry at Pakistan, so we can do a lot of good stuff after establishing the WES-based surveillance systems. So the next question, which is I think the most important question, is from Megan about the financing models. Megan, can you discuss that? What financing mechanisms are most promising for scaling WES globally? Should countries rely primarily on domestic budgets, blended financing, development banks, public-private partnerships, or multi-sectoral cost share? So what are the important variables?
Great. Thanks so much for this really important question. And I'll give the answer everyone hates. It's going to be all of them. And it's going to be very variable based on the country you're in and the context you're in. A couple things to mention is first, I think we need to look towards pathogen genomics and the story that emerged around how more financing flowed to scaling pathogen genomics globally and learning the lessons. I think, it didn't stay a single disease asset, right? We utilized the platforms for pathogen genomics for COVID, and many of those and the money taken from COVID survived to repurpose many of these tools for multiple pathogens. And on top of this, they were housed in national public health institutions. And so just thinking about how we leverage success stories from adjacent surveillance systems or complementary surveillance systems and use that as a roadmap or guidance. The second thing I'll say is there's a few ideas that come to mind. Is the first is about lowering the cost of utilizing WES. Again, coming back to the costing element, and also coming back to COVID, we look to other countries. Work that I previously did in India, they built an indigenous PCR kit that significantly lowered the cost during COVID and expanded to being multi-pathogen, and it was deployed in many cities. And as much regional or national capacity we can build to generate the products and tools that we need to implement something, the more cost effective it'll be. So that's investing. Also, I'm putting money out to get money back. So that it's a long-term investment in different innovations that are emerging that have the potential to reduce cost in the long run. The second thing I'll mention, which I already said at the top of the question, is about diversification. It's not going to be one funding mechanism that countries rely on. And this diversification can be big and small. At the WHO, we've recently launched the IPSN Catalytic Grant Fund. These funds are for catalytic projects to demonstrate the value of WES and really create the evidence base. And it'll only fund small portions of the WES program, but funding is funding that helps us drive towards the bigger picture of sustainability. But there's also things like the pandemic fund, where there has been funding for wastewater environmental surveillance when countries have asked for it. And then there's development banks and all these other resources that you mentioned that add a piece to the puzzle as we move towards domestic budgets for sustainability. The last thing I'll say is that financing often follows mandate. We can look to other regions and countries. The EU, for example, has a wastewater surveillance, a wastewater directive, and when there is mandate, there is often more funding that comes with it. So how do we leverage advocacy and these other tools that we have to push for visibility of wastewater surveillance so that we can have money flow towards it long term?
Okay, so thank you very much, Megan. But I have another question, which is very connected in the terms of low and middle income countries. Like many LMICs face competing health priorities with limited fiscal space. What advice would you give Ministries of Health on making the case for WES investment within an already stretched national budget?
I think this comes back to that conversation around that this will ultimately invest in upfront investment in wastewater surveillance will ultimately reduce costs down the line, right? So if you're able to do all the things that Afrinish just articulated, right? If you're able to do outbreak detection, if you're able to have stronger situational awareness, if you're able to deploy vaccines or health messaging quicker, you ultimately reduce cost and you ultimately save lives. You reduce the number of people that require health services or their disease is more advanced by the time they even present at health services. So it's really an economic case, an upfront investment, a relatively small upfront investment in WES now pays off way more, and you can try to say what way more means in your context down the line. And so I think that is a really powerful way to tie it together.
Okay, thank you very much. So, Dr. Vincent, now if we talk about lessons from successful blended financing, are there countries or regions you can point that have successfully secured blended or multi-donor financing for WES? Maybe examples from some Asia regions?
Thanks very much, Dr. Rihan, for the question. This is a very, ambitious question in the sense that, with our current engagements with the countries in Asia and also from our recent discussions in Bangkok, co-organized by WHO, HQ as well as regional office, Southeast Asia and Western Pacific office, and also the Ministry of Thailand. We actually learned a lot that many countries in Asia are still trying to facilitate the process of nationally financed WES strategy. But I must say that in our discussions with the Philippine country partners, they seems to have some success stories over having WES strategy be financed or co-financed by their national government, and this has been quite a long runway for them to build up these nationally financed co-financed WES strategy. which actually took them from the polio experience surveillance experience that they had started with through COVID, and then to beyond COVID and polio, looking at other pathogens. So I think there are some success stories that we are still trying to capture and trying to support with these countries. And I think that back to the question on whether there's a chance for even for blended financing, really depends on the cultural context and the national structure of how ministries are being catered to some of these budgets. And I think there's a lot of communications as well as engagement again back to the national champions for West to explore what would be the best lowest hanging strategies to try to leverage on based on the current national context. As Megan mentioned, that it is so important that we can try to integrate West as part of a horizontal program, leveraging on existing disease programs and in building or embedding some of these needs with West strategy could potentially help to come up with some sound and baby steps towards a national finance West program. So I think definitely there is a chance. It's a matter of time, and I think there's a need to have a continuous engagement with the relevant stakeholders as to build West as part of the horizontal integration program.
Okay, so my next question again from Megan is that the pandemic phase is over, but what is the WHO hub for pandemic and in epidemic intelligence wants to see in the West regarding the pandemic preparedness or epidemic intelligence?
I'm a broken record here, but we're going to want to think about wastewater surveillance as part of public health intelligence, right? And part of existing public health surveillance systems, not something that is in isolation on its own. We're also going to want to see a lot of evidence that it does translate to public health action, and also that it is something that can be implemented by ministries of health, and that there are the systems, tools, and global goods in place that enable that for countries to do it in a way that can be standardized, and so that these data can be interpreted globally. I think sometimes when we have these conversations around the increase in wastewater surveillance following COVID and its use for multi-pathogen detection, is we forget that it's still a relatively newer field, with the asterisk that there's a ton of incredible evidence for polio, and that's not up for debate. And now we have an immense amount of evidence for COVID. But we have to remember that both polio and COVID are relatively unique in the environment for which these use cases emerged. For polio, there was an eradication initiative that people rallied around, or institutions and organizations and governments rallied around, funding flowed in, it was very visible in a unique context. Similar for COVID, it was a global pandemic, funding flowed, there was a ton of visibility, and there was a ton of interest in investing in innovative methods to just stop the tragic spread of this pathogen that was taking lives. And so as we move out of this, these stages of outliers, right? So how do we go from these outliers and building the evidence for other pathogens when we're not in a time of crisis, when we're not, when there isn't a ton of funding? So it's kind of what we say in the US, a chicken and egg situation, is we need more evidence for different pathogens, and we also need more funding to get more evidence, right? And so I'm thinking back to a project we were working on many years ago in Bangladesh, a wastewater surveillance project in partnership with the Ministry of Health. And they said, great, we're really interested in partnering. show us the evidence, and then we will consider, more longer term investment and think about how we can integrate this into our broader public health surveillance strategy. And then the question is, where does the money come from to gather the evidence that is needed for domestic financing? And you start to get this loop. And so just taking, a step back there, the WHO and specifically the IPSN, the International Pathogen Surveillance Network, which the wastewater and environmental surveillance community of practice sits in, that I support and lead, is really thinking about building the global goods, building a toolkit that countries can leverage to build the evidence and strengthen their national systems. And the second thing I just want to mention here is the power of collaboration and the need for collaboration when it comes for wastewater environmental surveillance, and how there's such a rich community and relatively small community of WES experts who are doing this work all over the world in all different contexts. And there's immense overlap in the opportunities and the challenges that they're facing. And so as much as we can work together, we reduce the duplication of error, we more effectively and more quickly share learnings, we collaborate in ways that make our own national tools stronger for our own countries, but also the world. And so just a small pitch for the WHO wastewater surveillance community of practice, where we do this, where we bring people together from around the world to learn from each other, to inspire collaboration, and also to bring visibility to all the other amazing WES networks that are tackling these issues at a regional level. We think of Asia PGI, there's Globacon, there's EU WISH. Wherever there's a region, there's also an eager wastewater environmental surveillance community collaborating. And so as much as we can encourage institution to institution collaboration, country to country, and network to network, the quicker we'll get to a place where there is more sustainable financing for WES, and the WHO takes a really visible stance in this space.
Thank you, Megan. And now let's close our discussion. I would like to go around to each of you briefly. If you could recommend one priority action that every country should take over the next 5 years to ensure WES becomes a sustainable pillar of national public health and One Health systems, what would it be? So, Megan, over to you.
Public health integration, and really positioning WES as a complement to existing data streams, something that is not competing against it. And then the other half of that is coming back to the costing element and emphasizing the economic case for WES, and that the gains, if we invest now, are well worth the return on investment you get down the line.
So, Dr. Vincent, what's your thought about it?
I would be emphasizing on the importance of multi-sectorial communications, and it is so important again that these multi-sectorial communications really will help to enhance the value, the importance, as well as the importance of the sustainability of WES for public health actions. And I think it is so important that sometimes we are so excited about establishing WES, we actually forgot about the operational arms of executing the public health actions. So I think the multi-sectorial, within even the same ministries, it is so important to talk to people who are involved in the public health actions, and that will be so meaningful for the WES to be really seen to be something that is valuable for the public health. Without the public health actions, without the translation of WES signal to actions, I think we still may not have successfully make full use or maximize the investment that we have, initially started to dream of. So I think it's so important that we still continue to have this multi-sectorial, communications within the same ministry and beyond the same ministries. Thanks.
Thank you. And Dr. Afrinish, what's your take?
Thank you, Dr. Rehan, and thanks to Megan and Vincent for highlighting the key things. For a country like ours, what we see is that a little more effort towards creating the awareness among the multiple stakeholders to invest in the West and to realize the importance that how much good role West can play towards a preparedness and how much investing on the West can lead towards a cost saving. So that should be our target or the aim. And the real opportunity is to make West a shared platform that we are already discussing, then a separate program for each of these sectors. So we have to coordinate along with the existing sampling networks, laboratories, data systems, which can extensively, significantly reduce the cost and avoid the duplication. And the question should not be who owns the West, but who benefits from the West. That can make a good scenario for us to engage all the stakeholders and make use of the data that we generate for the public safety. Thank you.
Thank you very much, Dr. Afrinish. I can see a lot of good suggestions and questions in the chat box, but due to the constraint of the time, we are moving ahead for the closing remarks. This brings us to the end of truly rich discussion. On behalf of the NIH Pakistan, I want to thank our panelists, Ms. Megan Diamond, Dr. Vincent, Dr. Afrinish Ahmad. Dr. Muhammad Salman is at the ministry for the same project. We are excited about it that he is discussing over there. So he could not join in that moment, but definitely, as all of we know, that integration and communication is the basic thing where we can get it successful in its execution. So Dr. Salman is at the Ministry of Health. So generously sharing your time, expertise, and the perspectives with us today. A few clear themes emerged: the need for strong evidence, investment cases, the importance of national ownership beyond donor-funded pilots, the real-world value West has already delivered in places like Pakistan in case of polio, the range of financing models available to us, and the opportunity to unlock cross-sector investment beyond health budgets alone. To all our participants, thank you very much for joining us and for your excellent questions. We will be responding to these questions separately, and you can email to us as well. The e-certificates will be emailed to all the registered participants shortly, and the recording will also be shared in due course. On behalf of National Institute of Health, Pakistan, this concludes today's webinar. Thank you very much all, and have a wonderful rest of your day. Thank you, Megan. Thank you, Dr. Afrinish, and thank you, Dr. Vincent.
Thank you, Dr. Rehan.
Thank you so much.
Thank you.
Thank you.
Megan, take care. Have a good day. Bye-bye.
Take care.
Bye-bye. Thank you.